Welcome to Texas 2036's virtual series, Straight Talk Texas, where you have a front row seat to conversations on topics important to our future. My name is Enisha Shropshire, Director of Board and External Affairs here at Texas 2036. Today, Texas 2036 founder and chairman Tom Luce is joined by Dr. Peter Pisters, president of the University of Texas MD Anderson Cancer Center, the largest cancer center in the country. Dr. Pisters has led this world-renowned comprehensive cancer center since 2017. He previously served the institution in faculty and leadership positions for more than 20 years. An esteemed cancer surgeon, researcher, professor, and hospital administrator, Dr. Pisters has been repeatedly honored during his 2 decades at MD Anderson, earning 2 Fellows Outstanding Teacher Awards and 3 Faculty Excellence Awards. Tom and Dr. Pisters will discuss how MD Anderson has worked to continue to serve their patients, many of whom are already immunocompromised during this pandemic. Tom?
Thank you, and thank you, Peter. And I've been such a fan of your leadership of MD Anderson since 2017, and very much enjoyed coming in at your invitation to speak to some of your faculty and also your employees about the future of health in our state. And I admire very much what you're doing. And but you know, I'd be remiss if I didn't start by asking, you know, Houston, I'm proud to say, really has advertised itself as the diversity capital of the world years previously to this. And you have such a diverse workforce, and with racial discord across our country and the questions of diversity, I wonder if you just might speak to the diversity that you have at MD Anderson, both in your institution itself and the populations you serve.
Certainly, Tom, and hi, Anisha. It's great to be with both of you today, and I'm delighted to chat about all of these issues together. You're right, Tom. Houston is an incredibly diverse city, and for some time now, it's been recognized as the most diverse city in America. And there may be many reasons for that. It's something that we're very proud of. It leads to a lot of benefits for our community, and we see diversity really as a strength for Houston. That diversity is also reflected in our community here at MD Anderson. And when we look at our workforce, we see that diversity reflected with nearly 2/3 of our workforce being women, 1/3 Asian, substantial proportion African American, and Caucasian is a minority at MD Anderson. And when we look at our leadership ranks and we look at the vice president or above level, we can see 53% of our leaders are women and 40% are minorities. And so you see that even at high executive levels in the organization, that diversity is really reflected. And we see the full benefits of that diversity in better decision-making, in inclusion, in a broader base of stakeholder engagement, and so on. It's something we're very proud of.
Well, that's terrific. And I was, and then we were all impacted 2 to 3 months ago by the start of this pandemic. And how is that, I mean, you know, we tend to think of MD Anderson as this worldwide cancer center, and we're so proud of it. How does COVID-19, a respiratory illness, how has that impacted MD Anderson in your work?
Well, the impact of the virus globally has been significant, as everyone knows, and the risk to cancer patients is very significant because we know that the cancer themselves, plus some of the comorbidities that our patients have, create a very vulnerable situation. Their immune systems are compromised by the disease, by the treatment for the disease, or the combination thereof. So as we set out in late January to really get prepared for the pandemic, we put into place 3 goals that we stated internally and communicated externally: to protect our immunocompromised patients, to ensure the health of our workforce, and to partner to protect our community here in the Houston region. And putting into place a series of proactive strategies that at the time perhaps seemed overly aggressive by some, but turned out to be very prudent, I think have really helped to position us in a very secure way for our patients. When we look at what we've accomplished, We say internally that we believe that we may have created the safest environment in the world for cancer patients.
Wow.
And the reason I say that, Tom, is that when we look at the data and we look at COVID risk in our own patients, we have a 3.8% mortality rate in our own patients that we've cared for here at MD Anderson. The largest series in the literature just published last week in the Lancet journal from the United Kingdom, a study of 800 cancer patients demonstrated a 28% mortality rate. So when we look at our 3.8% mortality rate, or we look at the rate of COVID positivity in our employees, you can see the incredible environment that we've created to protect our patients and ensure that we can continue to treat at the same volumes, hopefully, as we rebound and recover.
Well, that was my next question. Are you seeing the volumes down, or people, and I'm sure part of what you were striving to do was to make sure by creating this safe environment, people were not afraid or they felt safe to continue their treatment. Are you seeing the volumes down?
Yes, we saw a drop in our volumes that was deliberate on our part in order to create capacity for a possible surge in March.
Well, and I know also pre-COVID, and we've all had to adjust to COVID, but I certainly was impressed last year and to watch what you've done about thinking about the broader mission of MD Anderson to the entire community, your region, how you can impact health in general of our population. Share with our viewers some of the viewpoints that you all are talking about internally, because I think that's of great interest to play off your strengths, but also what can you do for the community?
Well, we're part of a broad community here in the Houston region, and we know that there's a vast degree of inequity in our own community, and that there are large populations of what we would all agree are socially, medically, and economically vulnerable people. And we want to participate in the process to improve their care, and we do in a number of ways. We have a Department of Health Disparities that focuses on that research. We have a commitment to the underserved by bringing our faculty to LBJ Hospital and operating the oncology clinic at LBJ, bringing not only our doctors and our medical teams, but also our clinical trials increasingly for patients who are underserved and really need access to state-of-the-art treatments. We've also set aside $200 million in a quasi-endowment, and the funds from that are allocated for the underserved. And we have a whole series of programs with a faculty-led committee that looks at how to invest those resources on a yearly basis. We also, with our prevention group here at MD Anderson, really work hard on a lot of policy initiatives in Austin and in Washington as we really think about how we can impact through policy the kinds of changes to address and fix the problems that really create these inequities over time. And it's only through policy change that we're going to be able to have meaningful impact in the long run.
And in some of those policy changes, I'm trying very hard within the governor's task force to raise the issue. Of course, we all know we led the nation, or we're 49th or 48th or whatever in the number of uninsured population prior to the pandemic, but with the enormous unemployment claims we've had, people who heretofore have always been able to count on private insurance, although they may have the legal right to buy the policy, they may not be able to afford the policy. Our uninsured population is going to grow. And
yes,
we all know insurance per se is not the answer. You have to have access to health care and a place to go and a doctor relationship and prevention and all these things. But it's certainly an essential ingredient. And it's going to be a challenge we all face in the next 12 to 18 months. Wouldn't you agree?
I really do, Tom. I think that one of the important truisms that I think has come into sharp focus in the COVID pandemic is the reality that sound economic policy is rooted in sound health policy.
Yeah.
And that we really need to see how these two policy umbrellas need to be dovetailed in very strategic ways in order to ensure the economic health of a region or a country, a state over time. And hopefully the pandemic will bring this into sharper focus, and that we will be able to really tackle some of these challenges over time, because these health, education, and economic policies end up being absolutely critical to determine the future trajectory of Texas.
They really are. And, you know, I think, and I hope we've learned through this pandemic, you and I talked about, and, you know, everybody's feeling a sense of like, you know, when do we go back to normal? Well, we all know we're going to go back to a new normal. But
Right.
It's really up to us to determine what that new normal looks like. And I would hope that new normal is a recognition that the health of your neighbor matters to you greatly. It's just not your health, but the health of your neighbor, the person across town, the person in another part of town, all that. We haven't had much focus in this country on population health, and certainly preventive care. We're not. I mean, MD Anderson is a perfect example. I mean, you're the best in the world in stage 5, stage 4, stage 3, or whatever. But you've been moving down the chain itself to prevention and early treatment, and we've got to do that across the board. Wouldn't you agree?
Absolutely. As we you know, we think about the future of the state, and we realize how young our state is in many ways. We have a large population of young people under the age of 25, and their future, their educational future, their health is very dependent on changes that we make now. We have all the resources. We have the intellectual capital here, and I think we've got some smart policy people in our elected group, and we have Texas 2036, and no other state has that. And so I'm really excited in many ways, and partnering with you and others to really make good things happen for our state.
Well, and then, you know, I've mentioned to people, one of the reasons we have a good mortality rate on COVID is we have a younger population than most of the states in the country. And that has stood us well, even though we know that young people are not necessarily immune or in any way totally safe, but it certainly has been reflected in our data with regard to COVID. We are a younger state, and but we face a lot of challenges in our health system now. We've prevented the existing healthcare system from crashing, but we've got a lot of work to build the new normal of the healthcare system, is the way I look at it. And, you know, telemedicine, let's talk about that for a minute. I was talking with Dan Podolsky the other day, your colleague at UT Southwestern, and the number of telemedicine interactions they've had has just soared. And I'm sure that's true with MD Anderson. What has occurred in the telemedicine arena? And it's a much more complicated subject than cancer. You can't necessarily do that on like a primary care doctor might. But how's telemedicine impacted you in this COVID?
Well, it's really been interesting to see, Tom. We had telemedicine embedded in our strategic plan as something that we wanted to move into. And then as the pandemic unfolded, we plucked it right out of the plan and inserted it and operationalized it within a matter of 2.5 weeks.
Yeah.
And it was
like
really,
the University of Texas. I mean, you know, they went from ground zero to overnight. I mean,
that's right. And that was part of what I think of as the silver lining associated with the pandemic. And since then, we've done over 10,000 virtual care visits. And I found that our patients really like it for obvious reasons. As our workforce, we have 2,500 providers when we look at faculty and advanced practice providers. And as they really become used to it, they really see this as an amazing asset that we can use for access as people first contact the organization, and we want to connect people to our clinical teams to learn about the organization. We can use it during treatment in a number of ways, both for what we think of as provider-initiated visits, but also with patient-initiated visits, so that patients can initiate contact with us when they're having unusual symptoms, or they want to speak to somebody about an urgent issue. And we can use it for follow-up.
Yeah.
And it's an asset for clinical trials in a whole variety of ways that we're really learning about in real time now. So I really see telemedicine to be part of our long-term future, and hopefully a permanent change through the relaxation of a lot of the regulatory issues that previously limited the use of telemedicine. We have a large state geographically. MD Anderson has reach outside of Texas that could really be enhanced over time with telemedicine. And we'll be looking to hopefully work with others to see telemedicine be part of the future of healthcare in our country. We have to be able to leverage technology different than we have before.
Well, we really do. And I thought particularly of you and Mayo Clinic and in Cleveland Clinic, places like that. The relaxation of barriers on telemedicine was just so essential to the continuing provision, because I know you draw people from all over, but
that's right.
You know, the Texas Medical District itself, of course, of which MD Anderson is an essential part, is really a dynamic part of our state from a GDP standpoint, population health, I mean, you name it. And, you know, I've tried to explain to people, you know, one of the economic fallouts of this is we've had a lot of negative consequences to the health system, which impacts our economy. And so we've got some bright opportunities, but we need to make sure we rebuild the system in a viable way. And I just can't thank you enough for what you're doing. We could keep chatting and chatting, but any final words you want people to know? And but without further ado, I just really want to say thank you for what you're doing. And if we can help you in any way, you be sure and let us know.
Thank you so much, Tom. I really appreciate the partnership with Texas 2036. The group that you're leading really is going to help define the future for the state of Texas. And as you know, it's been really vital for us to formulate our strategic plan using the data that your teams have, and thinking about our commitment to the state of Texas, which we think is so important for our mission and our quest to end cancer.
Thanks so much, and we'll be in touch soon. Thank you, Dr. Pisters.
Take care. Bye now, Tom.
Thank you all for watching Straight Talk Texas. If you have questions and feedback, we want to hear from you. Email us at straighttalk@texas2036.org and follow us on social media and sign up to receive our emails. Visit texas2036.org for more information. Until next time, wishing you and your family well.